Today, I'm diving into a critical topic in the realm of neurology, extradural hematoma. Let's break it down in simple terms. So, what is an extradural hematoma? It's a collection of blood between the skull and the dura mater, that tough outer membrane covering your brain. This condition is often a result of head trauma. Now you might be wondering, what's the most common cause? Usually it's due to the rupture of the middle meningeal artery. This often happens following a fracture of the temporal bone. Picture this. You take a hard hit to the side of your head and bam, there's a fracture and artery rupture causing blood to pool. But how does this present clinically? Classic signs include an initial loss of consciousness, followed by a lucid interval where you might feel okay, and then a rapid deterioration. Think coma, seizures. It's a scary downhill slope if not treated immediately. What are the key symptoms to watch out for? You might experience a severe headache, vomiting, altered consciousness, and some neurological signs like ipsilateral pupil dilation and contralateral hemiparesis. In simpler terms, one of your pupils might get really big, and you could have weakness on the opposite side of your body. Now let's talk diagnostics. On a CT scan, an extradural hematoma appears as a biconvex or lens-shaped hyperdense area. Importantly, this doesn't cross suture lines, which helps differentiate it from other types of brain bleeds. And what's the primary treatment? It's pretty urgent. Emergency surgical evacuation is the go-to. Surgeons might perform a craniotomy or even a burr hole procedure to relieve the pressure. Alongside, supportive care is crucial to ensure the brain gets the help it needs to recover. So, what happens if this condition isn't treated promptly? The answer is grim rapid brain herniation and death due to increased intracranial pressure. That's why this is a medical emergency that needs fast action. Lastly, how does an extradural hematoma differ from a subdural hematoma? It's all about the source and shape. Extradural is arterial and lens-shaped, while subdural is venous and crescent-shaped. Knowing these differences is key for medical professionals to make the right call quickly. All right, folks, that's a wrap for today's quick dive into extradural hematoma. If you found this informative, hit that like button and subscribe for more medical insights. Stay safe and see you next time.